my name is May. I'll be your nurse practitioner for today. So what brought you here?
Oh, I have this very terrible cough, and
Mhm.
it's been going on for days.
Mm-hmm.
And actually, it is accompanied with a very high grade fever at some point, and I'm also like coughing out phlegm.
All right. So when did it all started?
It all started like I think 10 days ago.
10 days ago. And has it been constant or intermittent?
It was just on and off,
On and off.
fever and cough.
And you said it's productive cough, right?
It's productive, but this past 2 days I've been coughing up like blood, a
Mm-hmm.
little amount of blood in my phlegm.
Okay. And is there anything that makes it worse?
Yeah, every time I do simple activities,
Mhm.
I get shortness of breath, and
Okay.
it my cough as well.
And did you have any treatment? Have you tried over-the-counter medication?
Yes, I tried over the counter cough medicine, but
Mhm.
there were no relief.
So you didn't get better at all?
No, yeah. I didn't.
Okay. And you mentioned you had fever.
Yes, I did.
So it's accompanied with a cough, right?
Right.
What's the highest temperature you got?
The last time I checked, it was 100.3 Fahrenheit, but I
Mhm.
just took Tylenol, and
Okay.
it was really with Tylenol.
It was relief. That's great. Okay. And any accompanying headache?
Yeah, I do have like headache as well. Every time I cough,
Mm-hmm.
I have like headache. At the same time, I feel like tenderness or pain in my right ear.
In your right ear.
Yeah.
Okay. And that all started during the cough.
Yes.
Right.
Everything started when the onset of my cough.
Okay. So have you had any travel internationally for the last 3 months?
No, no, I haven't traveled.
Okay. Any chills or night sweats?
No.
Right. Did you have your COVID vaccines?
Yeah, I did have my COVID vaccines and my boosters as well.
Okay, great. So, do you have any medical conditions like a history?
That I don't know of, but I had a surgical procedure when I was still little. When I was 10 years old,
Mm-hmm.
they had my tonsils removed.
Okay. You remember how old were you?
10 years, I
10
think.
years,
10
okay.
years old.
And are you taking any medications at all, like prescription medication?
No, I'm not taking any.
Okay. Do you have any allergies?
I don't have any allergies, but I have a seasonal allergies. But I just tried like taking Benadryl over the counter before that.
Mm-hmm. Okay. So when was the last time you had the Benadryl?
During springtime.
Springtime.
Right.
Okay. May I know what's your occupation?
I am an English teacher. I've been
Mhm.
teaching kids.
Okay, nice. So is there anyone or your coworkers have the same symptoms at all?
Yeah,
at
I've
some point?
noticed most of our coworkers like having the same symptoms of mine. They've been coughing and having fever as well.
Okay. All right. So are you smoking?
Yeah, I've been smoking since I was 21 years old,
Mm-hmm.
and I'm 40 years old now.
Okay.
And I think I like finish like one pack of cigarettes per day.
1 pack a day.
Yeah,
Okay. How about alcohol?
I don't drink alcohol.
All right. Any illicit drug use?
I don't use drugs.
Mm-hmm. Okay. All right. So we'll go to your family history. Do you have any, like, in your mom's side, has some medical condition at all?
My mom, she's been diagnosed with hypertension,
Mm-hmm.
but their parents died in natural death. But on my father's side, he doesn't have any medical condition, but their
Mhm.
parents died with the complication of diabetes. I have
Like both of your father's
Yes,
side has
father's side
diabetes?
died with
Okay.
complications of diabetes.
All right. And your mom has hypertension.
Yes.
Do you have any siblings?
Yes, I have one sister.
Do you know if she has some medical condition?
She doesn't have any medical condition.
Okay. All right. So I just want to know, when was your last medical visit?
A year ago?
A year ago.
Yeah, my annual consultation.
Okay. And when was are you married?
I am married.
Okay. When was your last menstrual period?
Actually, last week was my last period.
Okay. So
That
like-
was Monday last week.
Okay. Great. Okay. So we're done with history taking. I'm just gonna do some review of system in general.
Okay.
You said you had fever. Do you have any fatigue or weight loss?
No, I don't have weight loss, but I have fever. I mean headache.
You had headache. Okay.
Right.
You had headache and it started with a cough.
Cough, yeah.
And do you know which part of head was it painful during coughing? Like, oh,
Whole on my head.
Okay.
Everything's hurting.
see. And how do you rate that headache
Like
from 0 to 10?
7, I guess.
7, but
Yeah.
it's already like relief, right?
Really with Tylenol.
Okay.
Tylenol helps.
All right, nice. So let's go on your eyes. Any blurring of vision, changes of vision at all?
No.
All right. In your ears, you mentioned ear pain.
Yeah, right.
side?
In my right ear, I feel like a pain in my right ear.
Mm-hmm.
But every time I take Tylenol, though,
Okay,
sometimes it
and-
helps, but it's still there.
It's also intermittent
Yes, it's
Yeah.
on and off.
during coughing.
Right.
Okay. And how do you rate that pain?
Well, 7 out of 10 still.
Okay, I see. And any discharges at all?
No.
Still? Okay.
No, I don't. No.
Nothing. And how about your nose? Any congestions?
No.
No congestions,
No.
right? And your mouth? Any sore throat?
No.
All right. Any neck pain, stiffness right there?
No, I don't.
All right. Any chest tightness or palpitation?
No.
No. All right. How about your shortness? Is there any shortness of breath at all?
Yeah, sometimes if I do like a strenuous activity, because I do exercise sometimes, but I
Mhm.
get like shortness of breath every time like I move it. Even if like going to the bathroom, it's just like
Especially like during coughing.
right coughing as well.
Okay, I see. And how about your abdomen? Any nausea, vomiting?
No.
Okay. Any pain in urination?
No.
All right. Any joint stiffness, swelling, extremities?
No swelling.
Okay.
No pain.
Any skin lesions or masses?
No.
All right. And have you have any painful or swollen glands?
No.
All right. Great. Now we're done with review of system. Now I'm gonna go ahead and start my physical assessment. So in general, the patient is alert and oriented, coherent and able to answer in full sentences, in good posture. Skin is appropriate with ethnicity, groomed well, and not in acute distress at this time. Okay, so let's go on. I'm going to start with your head. I'm going to palpate your head. Just want to check any lesions or masses.
Okay.
Okay. So, right, no lesions, no masses. So I would say head is normal cephalic, atraumatic, and hair is evenly distributed, no lesions, masses. And your eyes, I'm just gonna check your sclera. Inspection. Sclera is white, conjunctiva is pink and moist, and no discharges. Do you feel any pain there?
No.
No pain. All right, great. And I'm just gonna check your pupils. I just want you to look straight. All right. Good. Pupils is
Where should I look?
just look straight. Yeah. Okay. Pupils is reactive to light and equally round. Can you look at my finger and follow my finger? Okay, and reactive to accommodation. I'm also gonna test your extraocular movement. I want you to follow my finger with your eyes. Okay, great. Up. All right. Nice. All right. So extraocular movement is intact. Now let's see your Snellen chart. I want you to read this. Can you cover your left eye? All right. Can you read this third line?
LCF
Other side, please.
DHJBS.
Okay, great. Patient has 20/20 vision. Sorry. Now let's move on to fundoscopic exam. Fundoscopic exam. I'm just gonna check the back of your eyes. I wanna see. I want you to look over my shoulder. Okay. Okay, great. The other side. Look over my shoulder. All right, good. So, optic disc is well defined. No even nicking, important rule spotting. And then let's move on. I'm just gonna check your facial nerves. Okay, just gonna check your sensation. Okay, I want this is dull and this is sharp. Okay, so just tell me which part of your face do you feel it and how does it feel? Okay, can you
Okay.
close your eyes, please?
Left cheek and it's soft.
Okay.
Right cheek and it's soft.
Mhm.
Tip of my nose and it's sharp.
Okay, great, perfect. Now I tested your cranial nerves and sensations. Now let's move on to your ears. Okay. So by external ears, I can see any redness, no redness at all. I'm just gonna palpate it. Do you feel any pain there?
Just my right ear.
Okay, how about the external here?
No.
You don't feel the auricles and the mastoid? Do you feel any pain there?
No.
Nothing. Okay, so no pain and no redness on the external. Let's move on to internal. I'm just gonna check this is your right ear. Check. Okay. All right. Tympanic membrane. I can see some erythema in there. Okay. And some no discharges for there. And here, see. All right. Okay, tympanic membrane is pearly gray. All right. And also, we'll try this Weber's test. I'm gonna ask you if you feel if you hear the sounds on both ears. Okay.
Okay.
Right.
I hear it.
Both ears.
Both ears.
Okay, great. So there's no lateralization of sound for Weber's test is positive. Now let's move on to Rhine's test. Right. Tell me if you stop hearing the sound, okay?
Okay.
Let's start with your here.
Stop.
You don't hear it anymore?
Yes.
Okay.
Stop.
Great. Okay. This the right ear.
Stop.
Okay.
Stop.
Okay, great. So Rhine's test is positive. Air conduction is greater than bone conduction. It's great. So we're done with that. So I'm just gonna check your facial nerves. Okay. Can you puff your cheeks? Great. And then can you lift your eyebrows? Nice. And can you open your jaw up and close and stick out your tongue and move it side to side. Great. Perfect. What else? Okay. So that's it. Good cranial nerves there. Can you shrug your shoulders too? So it's testing your accessory muscles. Okay, perfect. Again. Nice. Perfect. All right, now let's move on to your mouth. Let's do your nose first. Okay. So septum is midline. Just gonna check inside your nose. So nasal mucosa is pink and moist. We just have some your turbinate is kind of boggy. Okay. And let's move on to your mouth. Good job. All right. All right. Oral mucosa is pink and moist. I can see any tonsils. I would say it's absent. There's no exudates and erythema. Great. That's it. Now let's move on to your neck. All right. Just gonna palpate your neck and tell me if you feel some pain. No. All right. Trachea is midline. Can you swallow? Nice and palpable. Thyroid. Good job. All right. Okay. Just gonna check your lymph nodes. Do you feel any pain, tenderness, posterior? All right. Great. Now let's move on to your respiratory. Can you remove your yes. This is gonna inspect your chest. Okay, so I would say Anterior posterior diameter is appropriate. Symmetrical expansion preserved. All right, just gonna palpate if you have some pain in their chest wall.
No.
Okay. No reported pain in the chest walls. All right. So I'm gonna do some. Can you yeah, move on that side? All right. I'll do first some tactile primitus. I want you to say 99.
99.
Good.
99. 99.
Okay.
99. 99.
Okay. So I can feel some
99.
consolidation like on your posterior lobe. Can you say it again?
99.
Great. Okay. I'm just gonna hear this sound of your lungs. Okay, I want you to inhale. Great. Okay, all right. Okay, vesicular sounds and upper lobes. Okay, but I hear some crackles on your posterior lobes. Okay, inhale. Okay, great. So this time I want you to say the word 99, okay? I'm just gonna hear I'm testing your bronchophony.
99.
Okay.
99. 99. 99. 99. 99. 99. 99.
Okay, great. Now this time I want you to say the word E. Say E every time I hear you. Listen to your lungs, okay?
Okay. E. 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 E.
Mm-hmm.
E.
Great.
E. E. E.
Okay, perfect. Right. So let's do some percussion. Just gonna listen to your any sounds. Okay, can hear some resonance and some dullness on your posterior. Okay. Okay. Now let's move on to your chest. I'm just gonna, for inspection, I can't see any lips or heaves, carotid, no thrills. Just gonna listen to some brewy sounds in there. Okay, so I cannot hear any brewy sounds. I'm gonna listen to your heart sounds, okay? So you have to hear your aortic valve, pulmonic, all right, ears point, okay, tricuspid, and your mitral. Okay, S2, S1 and S2 is here. No murmurs, gallops, or rubs here. I'm just gonna see your point of maximal impulse. I want you to lean your left side. Just gonna see your, so PMI is in the fifth intercostal space, mid-clavicular line. So 1, 2, 3, 4, 5. Okay. So by palpation, there's no heaves or thrills. Just gonna listen to it. Okay, great. S1 and S2 is here. No murmurs. Great. Thank you. Now let's move on to your GI. Is it okay if you can lean? Okay.
Lie flat.
Yeah, lie flat. Thank you. So by inspection, there's no distension noted. Just gonna listen first. Okay. Okay, I can hear normal active bowel sounds. All right, and I'm just gonna palpate. Okay, just show me if you feel some pain in there.
Mm-hmm.
Is it painful?
No.
All right, nice. So abdomen is soft, non-distended, and non-tender. Right, great. We're done with that. Yeah, you can sit down, and now let's move on to your muscles, musculoskeletal. Just gonna test your range of motion. Can you like bend your raise your arms? There you go, and there. Good. Next one, and then right. Let's do your range of motion in your knees. Can you lift your knee? There we go. Good. Okay, and then your hips. There. Great, perfect. Range of motion is intact on both upper and lower extremities. All right, just gonna check your pulses. Okay. All right, +2 pulses in upper extremities. Dorsalis. And +2 on the lower extremities. Now let's have test your strength. Okay, can you push against me? Okay, perfect. And how about here? This one here, I want you to push against me. All right, lift. Okay, perfect. That's it. And then now let's move on to your neurologic. I would say that patient is alert and oriented. All right, and then let's see. I'm gonna check your sensation. I want you to close your eyes and tell me where do you feel it.
Right arm, right lower arm,
Okay.
left upper arm, right upper leg, left lower leg.
Okay, perfect. Now let's move on. I want you to stand up and just want to test your gait, and you can walk right here. Nice. Okay, nice gait. All right, you can sit down now. And then let's check. I just want to check this. If you can determine what letter I am writing.
Capital letter A.
Okay, great.
0 or O.
Okay, perfect. Nice. And then I want to test your coordination as well. Can you like tap your legs with your palm, like alternate? Okay, close your eyes and do it as fast as you can. Okay, nice. And then let's do coordination with your fingers. I want you to tap your fingers with your thumb as fast as you can. Okay. Nice, perfect. All right. So we did all your exam, head to toe. We're done with that. For now, as far as your symptoms and my assessment is concerned, I'm concerned with upper respiratory infection, so we'll do some chest X-ray and some labs. Okay.
All right.
All
Sounds
right.
great.
All right. Thank you.
Thank you.
Right.
Mana?